Students, today we will see about how to organize a health education in a village. This is a commonly asked question either the PG or UG or diploma nursing students. Especially nurses, we have to organize a health education program. So the education program, how we have to organize. I have given you some few steps of organizing. These 12 steps you can remember and you can write in between the steps in your own words you can write. So the first one is collect the information about the health problems in a village. How will you collect the information from the health problem in a village? If a teacher is putting a village, you make a transact walk in the village. Just walk. While walking itself, you can see the road, you can see the sewage is open, cow duck is there, or how the ken is there, where they take the water from the pond, what they do, or they clean. Many things you can watch. Once you are watching, many people will come across, Ma, where are you coming from? Which school or college you are coming from? Then you talk to them during your transact walk. Ask, what are all the problems in your village? So they will tell, yes, we have some diarrheal disease problem in that house. Somebody is sick. Someone falling with a stroke and all are having a diabetes. Just take a paper and note. Prioritize the problems. How do I prioritize? Just first list down before prioritizing. Then how will you prioritize? Just list down it and how many people is affected. Which is best communicable disease you first given important rather than the non-communicable diseases. Correct? That is called prioritize. So then third step is identify the correct problem for health education. How do you identify? When you prioritize by selecting that one problem you will identify. For example, some people are having a COVID-19 in that place. Many are affected or by the diarrheal disease are coming. So take that particular problem. Then set the goals and objectives. How do this goal should be? The objective should be, the goal should be always smart. What is smart? The goal should be simple. After my health education, they should gain knowledge. And after my health education, the morbidity rate has to be reduced. The mortality rate has to reduce. Simple. So the goal should be simple. It is measurable, right? If it is measurable, it is reducing or not the mortality. So it is attainable. Then it will be time bound. Understand? Simple, measurable, achievable, and it should be realistic and will be time bound. Okay, it is realistic means I can reduce it or reality. It is not that we are setting a goal that within 1 month I go to the moon or the sun. It is not a realistic. It is really unrealistic, right or not? Or next month I will build a hospital here or bring the primary healthcare center over here for the people. It is unrealistic. So what you can do realistically for that particular person's health, for the self-reliance, what we studied, no, the end result of the health education is a behavioral change and the self-reliance, right? Okay, next is assess in this particular disease what health education I am going to give. It does need knowledge only to improve, or attitude has to improve, or attitude means behavior, or does they need some skill? For example, boiling the water or anything, they does need the skill. Then for the problem, according to this KS assessment, you put a questions, pre-test question. Diarrhea is coming only by unclean water or whatever it may be, one checklist or something, you make a question. They will answer it before your health education, correct? So after assessing the questions, making the pre-test question, you are already planned to conduct the health education. Next, you will assess the resources available. What is the resources? How will be resource? What all the resources does need for the health education? You does need man, money, material is the resources. What is man? Man is the resource person. Who is the person will be coming and going to talk. That person should be a credible person. That should be person is a respectful person. And the money, what is for the refreshment or tea or coffee, and what I am going to spend for my AV aid, or I am going to borrow one mic set, or I am going to mobilize mic set from my college, or the aviates from the primary healthcare center, or I need a speaker, one day speaker, how much is the money, who is going to donate that money, that is what. And remuneration, whomever you are asking to speak or give education, do we need to give any money to them? You have to think about it. And the material, IEC material, information education communication material in their own language, posters, is it available? You can take it. Okay, then preparation for the plan of action, right? What to do, when to do, how to do, where to do, whom to do. So where is the place, what is the time, what is the venue? You select the time where that important serials are not going. So you, the most of the peoples na, they are very much attracted towards the serial. Some, so you select the time where there is no attracted TV serials, they are not addicted that particular time, they come, which is the place they can very well accessible, not away from their house or under the tree or the primary healthcare center or school. You check. And what is the target population? Mostly the female, men will not be there. The women is the one who take care of the health of the family. So our target population, men or women, decide it. Then you, what is the target population or the children, and plan the agenda accordingly. And you make it and circulate the program agenda. What you will do, schedule for the field, like what are you going to do? Hey, come, today we are going to have a skit, drama, songs, dance we are going to play. Come, like that you have to make an agenda. Once they are coming, you give them the pre-test questionnaire, assess their knowledge, and before implementation, how much score, keep it away everything. Then will be implement and conduct the health education program, either the lecture or drama or skill or seminar or skit, anything according to that you put it and convey the message. And then monitor the behavioral change in the village and do the post test over here. And post test, if a knowledge, okay, knowledge can be assessed now, but in a behavior, that behavior has to be assessed when you go for the next visit to the community. So if possible, if you find out the positive feedback, it is very good. You reinforce them, appreciate them. Yeah, very good. Whatever we thought, now you are boiling the water and drinking, you are washing your hands, you are cutting your nails. Excellent. After defecation, you are doing etc. 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 Very good. Or you are cooking in a way what we told. Don't to cut the vegetables and wash and cover the vegetables while cooking. Anything, whatever you have X and Y you taught, just see whether doing it or not. If it is either thing positive or negative, if it is a positive, do the reinforcement whenever you go, appreciate them. If it is negative, you have to reassess and repeat and replan, redo for the health education. Clear about it? So this is the question will be asked to you. How will you organize a health education program in a village? Just write on one intro. What is health education? Health education is the backbone of community. With the health education, we can modify the behavior of the individual. The individual behavior being modified, the whole societal and country's behavior attitude will be changing. This is my introduction. Then you write about what is the definition of health education. The health education is process by which help the individual to behave in a manner, whatever that encourage the people to behave in a manner, or to know how to do, how to collectively feel healthy, or to seek the help. Any one definition you write it. Then only you have to write the steps of health education. In the steps, and after the step you can write the conclusion. In the steps, madam, just I have given only the word and collect the information about the health problem of village. I told you here. Right, do the transact walk in the village, find any people, casually talk to them, collect the information I told while explaining. So that explanation should be written over here. If you write these steps, you will surely will get 13 or 14 mark out of 15. So as a nurse, you have to remember all these points in the giving a health education. If it is an individual health education also, you ask what they know, then you teach what is unknown. Don't like stereotypically teach the people, yeah, diabetes is the disease, oh, etc., etc., hypertension. Don't talk like that. What do you know about diabetes? How long you are having? Tell me about the diabetes. Tell me about hypertension. What drugs? How long you are checking? Interact and appreciate them when they tell something. Then only they will be interested on you. Don't impose people anything. Just a casual tact. You have to reinforcementally, you have to change their behavior and attitude. Why I am stressing is that the health education is a backbone of the country or the community. Correct? Thank you. All the best.